All right, I think we're ready. Good morning, everyone. And thank y'all so much for coming back. And if this is your first time in one of our sessions, for coming this morning to our developmental screening summer webinar series. My name is Dr. Teresa Northington, and I'm the developmental screening coordinator for the Bureau of Family Health. And it is my great pleasure today to introduce our webinar, which is aligning practice with a medical home model, enhancing care through key competencies. Please note that this webinar is being recorded. Before we begin formally, just want to make sure that you're aware if you are a social worker, a registered nurse, nurse practitioner, or a physician, and you'd like to receive CE or CME credit hours or contact hours for attending today's session, please be advised that you must attend the session in full and complete the evaluation at the conclusion of the webinar. And for our disclosure today, just a little disclosure I will be reading. Today, Julie Emery and Kaylee Hall have disclosed that they have no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All relevant financial relationships have been mitigated. Our speakers for today are Julie Emery and Kaylee Hall. Julie Emery is a medical home coordinator and the Learn the Signs Act Early Louisiana ambassador. And Kaylee Hall is the ECCS grant coordinator and care coordination special projects for the Bureau of Family Health. Sorry, thank you so much for being here. And I turn it over to both of you.
Thanks, Teresa. Just a minute and get my slides up. Kaylee, Teresa, can you give me a thumbs up if you're seeing the slides?
I'm seeing them, but not in presentation mode.
Okay, well, let's see. On my screen it is. We'll try it again.
Now you're good.
Okay. Excellent. So we love starting with tech issues. Good morning, everyone. Like Teresa said, my name is Julie Emery, and I am the Pediatric Medical Home Coordinator for the Bureau of Family Health, Office of Public Health, Louisiana Department of Health. I'm also the Louisiana Learn the Signs Act Early Ambassador. So with both of these roles, I have the honor of supporting healthcare professionals and community partners with medical home components, developmental monitoring, and screening. So super excited to be here today. I'm here with my colleague, Kaylee Hall, who will give her formal introduction a little bit later in the slideshow. So let's look at what we will be discussing today. This webinar will provide a comprehensive overview of the medical home model. It's going to focus on its key principles and the essential components required for effective implementation. We hope that you will learn what constitutes a medical home, how it promotes patient and family-centered care, and then the role of healthcare providers ensuring this coordinated care. We're also going to explore specific competencies necessary for professionals to deliver high-quality services within the medical home framework. And again, we hope that you leave with a clear understanding of how to align your practice with these competencies to improve patient and family outcomes and ensure a seamless healthcare experience. Some of the elements and components that we'll be focused on today will be developmental screening, care coordination, and youth health transition. A medical home is a patient and family-centered approach to providing comprehensive, coordinated primary care. It is a team-based health delivery model organized across all elements of the broader healthcare system. And it includes active collaboration between families, between primary care providers, clinical specialists, behavioral health providers, hospitals, and community programs, including the education system. This concept was introduced in 1967, and it was introduced as a central location of a child's medical record. So that's where the term began. But in 1992, the American Academy of Pediatrics published a statement defining the medical home, which was then updated in 2002. And then in 2010, the Patient Protection and Affordable Care Act was signed into law by President Obama, emphasizing the implementation and promotion of the medical home model for children and adults. Since then, it has become a widely accepted model, and it's truly considered the gold standard of how pediatric primary care should be organized and delivered throughout the healthcare system. Receiving care in a medical home is recommended for all children, but it's truly essential to ensuring optimal outcomes for children and youth with special healthcare needs. So let's take a brief look at each of these elements that you see on your slide that the American Academy of Pediatrics has used to define the medical home. So number one being accessible, and that means that care is easy for the child and family to obtain. So thinking about things like geographic access, the hours of operation. Is there an online portal to set medical appointments if the family caregiver is working during the hours of the day? Is there insurance accommodation? So families are able to access the care that they need when they need it. The next is family centered. When the family is at the center of care, they are recognized and acknowledged as that primary caregiver and support for the child. And the medical home ensures that all medical decisions are made in true partnership with the family. So that means that those decisions are made together and not just communicated to the family, but the decisions are within partnership. The next is continuous. The same primary care clinician cares for the child from infancy through young adulthood, providing assistance and support to transition into adult care. So we want that child to be able to stay in one continuum if at all possible. Comprehensive. That bundles preventative, primary, special care services for the child and family together so that all their needs are met under one umbrella. So we're not separating out clinical care for a diagnosis and preventative care. It is all met together and thought about together and delivered together with each in mind in a comprehensive framework. Coordinated, a care plan is created again in partnership with the family and communicated with all healthcare clinicians that are involved with the family and necessary community agencies and organizations. So again, thinking back to our children and youth with special healthcare needs, when there are multiple healthcare providers in play, that it is coordinated and communicated to each one of those individuals so that we are all working together for the care of this child and family. Compassionate, that we are demonstrating a genuine concern for the well-being of child and family, and that is being emphasized and addressed, and intentional about how we ensure that we are providing that compassionate care. And last but not least, culturally effective. The family and child's cultural, language, beliefs, and traditions are recognized, valued, and of course, respected. Okay, so why is this patient and family-centered medical home important? There is a collection of evidence supporting the medical home model. Research indicates that when children have a continuous source of care, they are more likely to access preventive care and immunizations. They're less likely to be hospitalized for preventable conditions, and they're more likely to be diagnosed early for chronic conditions. There's also a connection between access and utilization of a pediatric medical home to improved population health outcomes.
I think Julie's a bit frozen. Oh, okay. Oh, Julie, I think you're a little frozen. Would you be able to go back just a little bit?
Am I unfrozen now?
Yes.
Okay.
Hmm.
Did we hear any of this?
A little bit, maybe the
Yeah,
beginning.
okay. Okay, thank you. I just got a message that my internet is unstable, unfortunately. So let me know if that happens again, and I may need to turn my camera off. So basically on this side, it's just letting us know that there is a tremendous of research that is out there supporting the medical home. We know that families who receive care in a medical home, they're more likely to access preventive care and immunization. They're less likely to be hospitalized, and they're more likely to be diagnosed early for chronic or disabling conditions. And as we know, when they're diagnosed early, then we can get them into any type of early intervention or care that is more successful the earlier we can reach. Okay, here we wanted to look at the population of children and youth with special health care needs. This population of children have or are at risk for having chronic physical, developmental, behavioral, or emotional conditions. They have conditions such as asthma, sickle cell disease, epilepsy, even learning disorders, and they may require that more specialized healthcare. But there is also a significant difference between the overall well-being of our children and youth with special healthcare needs and their families compared to children without. If you look at the chart, it shows both children and youth with and without special health care needs and the challenges they face. And so those children with special health care needs are 41% of these children struggle with food insufficiency. There's also a significant proportion difference between housing hardship and medical hardship as well. And so this statistic really paints a clear picture of the importance of high quality comprehensive care for children and youth with special health care needs. And then we look at how we're performing as in the medical home in the state of Louisiana. We've been in this space for many years, and the National Survey of Children's Health states that 43% of our children with special health care needs report receiving care in a medical home, which is above the national average, which is exciting, but we still are looking to increase that. And there were a little bit below the national average for families without special health care needs. So definitely some continuous work to do. Through various initiatives, the Bureau of Family Health has distilled the medical home into three essential healthcare services with multiple touch points to allow for care that's accessible, family-centered, continuous, comprehensive, coordinated, compassionate, and culturally effective. So these three key medical home elements that we're going to look at is universal developmental screening, holistic care coordination, and youth health transition. Over the last 5 years, we have developed companion quality improvement toolkits to each one of these elements. And each of these toolkits support healthcare providers with practice assessments and development of a stepwise, doable quality improvement plan to either expand your implementation or begin. So we'll look at developmental screening first. In Louisiana, we use the general term of developmental screening when we're referencing 5 screening domains that support early identification of risk and creates opportunity for intervention. So those categories are general developmental milestones, autism, perinatal depression, social emotional development, social barriers to health, or a term you may be familiar with, social determinants of health. So again, we look at where we are as a state. We have worked to increase these rates since 2015, and we are proud to report that we are currently performing above the national average, according to, again, the same survey, National Survey of Child Health. So you may or may not be aware that Louisiana has specific state recommendations for developmental screenings. These guidelines, as you can see in your slide, were originally developed in 2015, but they, of course, have been updated with an expert work group that reviews this particular guidelines. They outline which screenings should be performed and when they should be performed and what tools should be used. The dark orange boxes is the periodicity table indicated by the American Academy of Pediatric Bright Futures. And then the light orange boxes are supplemental screenings that were added to meet the specific needs of Louisiana's children and families. These includes additional screenings such as social emotional and those barriers to help that we spoke about, which really helps to have that well-rounded view of the child and family's current experiences, strengths, and needs. A little bit delay of when my slides change. This table lists the caregiver completed instruments recommended by the work group that have been validated in similar populations to Louisiana. These screening tools assess child's development, their environment, and their risk for developmental delays and other concerns. Note that there are many other screening instruments available, but the ones listed on the guidelines were determined to be a good fit for Louisiana. If your practice is using a valid instrument with fidelity, meaning that the entire screening tool is being used, then that is okay as well. But it's important to note that the AAP and the Louisiana Medicaid both recommend using parent-completed tools. And as I mentioned above, we do have a companion toolkit for each one of our elements. This is a virtual one-stop shop for all things developmental screening and offers a plug-and-play tool to walk practices through small or large quality improvement initiatives. Within these web pages, there are instructional videos on all of the recommended instruments, downloadable worksheets, and resource guides to support appropriate referrals when risk is identified through the screening. And then we also have supportive developmental screening resources that are region specific. And so those resource guides will cover screenings for autism, family wellness, and then general and social development. So you're welcome to snap a picture of the QR code if you want to grab those, or the website as well. And that concludes my portion of the presentation. And so my colleague Kaylee is going to switch over her slides for just a minute, and we will continue on.
Thank you, Julie. Can everybody see the care coordination slide? Okay, great. Good afternoon. As Julie mentioned, my name is Kaylee Hall. I am the grant coordinator with the Bureau of Family Health for Project SOAR, and that's Screen Often and Accurately Refer. And for the second half of today's presentation, as Julie mentioned, we are going to cover care coordination and youth health transition as components of the medical home. And simply put, we know that care coordination improves outcomes. It takes a holistic approach to patient and family care, and it recognizes that the needs of that family do not stop when the family exits the office doors. By definition, the national standards defines care coordination as those patient and family-centered, assessment-driven, team-based activities that are designed to meet the needs of children. According to the 2022-2023 National Survey of Children's Health, 61% of Louisiana children and youth with special health care needs who required care coordination actually received the services that they needed, and that's represented in orange on the left. In comparison, 78% of non-children and youth with special health care needs who needed those care coordination services also received it, and that's represented in orange on the right. In both of these groups, Louisiana's performance does exceed the national averages represented in the purple, and that demonstrates a relative strength in care coordination across our state. Now, some of you may have encountered the health outcomes models in the course of your work. These models examine factors that contribute to an individual's long-term health outcomes, and quantifiers of a health outcome are going to be length and quality of life. Through in-depth analysis, epidemiologists, they're able to determine factors that ultimately impact an individual's health outcome. So we certainly stand before you today to make a case for care coordination and effective community referrals, and we certainly hope you will consider these services just as important to your patient's health as treatment for acute and chronic illnesses. And yes, we do have data to show you why. So according to the County Health Rankings Health Outcomes Model, clinical care has been found to contribute 20% to an individual's overall health outcome. In contrast, when you look at social and economic factors, as Julie had mentioned prior, they account for 40%. And those are things like food security and nutrition, parental interaction and support, parental mental health, safe sleep, safe neighborhoods. It's looking at healthcare deserts. All of these things are going to impact the health and development of children and adolescents. When you consider high poverty rates, provider shortages, and the percentage of our population with substance use disorders, we know that Louisiana's children are at a high risk. So it's clear that addressing these factors is crucial to our population. And by connecting families with community resources that ultimately address their needs, providers can help support the health and well-being of the entire family. And we're going to share some resources in the upcoming slides to support this as well. So Julie presented on the medical home. How did we get to talking about care coordination? Care coordination, as stated prior, is a core element of the pediatric medical home and a core component of federal and state efforts to improve health outcomes, reduce that caregiver and patient burden, eliminate redundancies, and ultimately decrease healthcare cost. Care coordination addresses all of the things, medical, social, developmental, behavioral, educational, and financial needs to achieve optimal health and wellness outcomes, and ultimately that efficient delivery of health-related services within and across those systems of care that are going to touch that child and family. Now, effective care coordination supports multiple outcomes. And that's going to be your access to coordinated, ongoing, comprehensive care within a medical home. Those family and professional partnerships at all levels of decision making, so that family-centered care, access to adequate financing and private and or public insurance to pay for those needed services. So that's looking at your benefits, information, and linkage. Early and continuous screening for special health needs, organized community services for easy use and access, and then that transition from youth to adult health care, work, and independence, which we're going to talk about a little bit more in a few slides. Like developmental screening, the care coordination toolkit developed by the Bureau of Family Health also offers providers a detailed support plan, and this is to implement various levels of care coordination using a quality improvement framework. It is, again, that stepwise approach, and it's designed to maximize clinic capacity and make implementation of care coordination services efficient and effective. You might be feeling this way now, but we know care coordination is complex. It is a very broad topic to talk about, and you can find multiple definitions on the internet applied in multiple different ways. But the best thing about this toolkit is that it does provide teams with information needed to develop and implement very manageable improvement targets for pediatric care coordination services. And it might look different based on your practice. A practice can determine care coordination service goals based on your technology, what does your staffing look like, and what is your spatial capacity. And there are worksheets that can guide teams through each step using this quality improvement methodology, so it really does break it down. As Julie had also mentioned prior, all of the provider toolkits are available at no cost to providers. In addition, there is a request form available for technical assistance, implementation, and resources. Or in other words, if you're looking for additional support and coaching, we have that as well. The care coordination toolkit in itself is going to walk you through 3 primary quality improvement steps. And that's going to be assessing your current care coordination services, what's already happening, developing a plan and training your team, and easy ways to do that, and implementing a quality improvement plan. Sometimes practices come in with a very specific focus. They ensure that it is successful and sustainable, and they may repeat the process with another element. To support care coordination and navigation of referral services, which we know is a very important second step after screening, the Bureau has created additional resource guides with pediatric and adolescent services and programs that are going to be available to children and families. There are 9 region-specific guides with contact information, eligibility requirements, and services that are offered by each of the programs on the sheet. The guides are updated at least annually by the Bureau, and they are downloadable. Many times providers will come to us looking for quick access resources or one-pagers that they can reference and direct to their family. So we made sure that these are all easily accessible online and can be found within the toolkit resource section. So maybe you're not ready to fully implement changes across your clinic, but you want to bolster your resources. So we made sure that we have that as an option as well. To this point, we've provided an overview of the medical home model. We've highlighted developmental screening and care coordination as components of that medical home. And we're going to continue with the third and final component, and that's youth health transition, or those services that are a part of those adolescent well care visits. By definition, youth health transition is that process of preparing young people to move from pediatric care to adult care, work, and independence. It's a planned transition from child-centered to adult-centered medical care, and ultimately it helps youth gain the independent healthcare skills and prepare them for a new set of clinicians, which can look and feel very different. We found and we know that many providers don't necessarily connect with the term youth health transition. It's more of a public health research term. But again, it does fall within that realm of high quality adolescent well care visits. We know that youth health transition supports and services is an area where Louisiana is still lagging. Again, many providers don't identify with youth health transition from a service provision standpoint, and it shows in the data. According to the National Survey of Children's Health, again for 2022-2023, about 16% of children and youth with special health care needs received necessary services for transition to adult health care, compared to 13% of non-children and youth with special health care needs. Both of these numbers represented in orange are below the national averages represented in purple. So work to be done. We know that youth health transition supports adolescents in acquiring those independent life skills, preparing for the kinds of healthcare that they're going to need as adults, and transferring to new providers without that disruption or gap in care. We know also that adolescents benefit from youth health transition services through having an easier time accessing the healthcare they need, increasing their ability to live independently, and ultimately, again, decrease those healthcare costs. Youth health transition is a combination of anticipatory guidance and care coordination for emerging adults as they do prepare to that shift from pediatric to an adult model of care. Over the course of adolescent well child visits, we want to help support the development of an activated healthcare consumer at the end of the day. How to do this? A starting point is conversations about transition should start with a parent, caregiver, and youth between the ages of 12 to 14 years old. Caregivers should be asked to step out of the room for part of the visit, allowing time for that youth to speak directly with their healthcare provider. And of course, that's going to be when it's developmentally appropriate. Transition services help youth ultimately take control of their health so that they can develop life skills and reach their maximum potential. We recognize that transitioning youth to adult care can be quite challenging in today's healthcare setting. GOT Transition is a program of the National Alliance to Advance Adolescent Health. They've created a list of 6 core elements to help healthcare professionals work through the process of doing this. The site is gottransition.org. You can go on here to find the most up-to-date research on youth health transition. There's also a ton of provider and family resources. The 6 core elements that they lean into is developing a transition policy, transition tracking and monitoring, transition readiness, planning, transition of care, ultimately leading to the transfer completion. And yes, if you were wondering, we do have a toolkit for that too. The Bureau's second iteration of the Youth Health Transition Toolkit mirrors the developmental screening and care coordination, and it follows the same stepwise quality improvement approach. So when you go onto this site, it's going to look very similar. There are plug and play quality improvement initiatives and a whole lot of very specific resources to support transition in your practice. For those of you who are interested in adolescent care, here is a list of key web resources. So again, gottransition.org, Smooth Moves, YHT.org. This is a website intended for teens with activities and tools to help them build those school skills that we referenced in order to be independent. And then on the LDH site, our hub for healthcare professionals where you can find in-depth information about transition. There's also links to other organizations and public health agencies that are also involved in supporting transition services. And with that, on behalf of Julie Emery, the Bureau's Pediatric Medical Home Coordinator who got us started today, myself and the medical home team, we certainly want to thank you for attending today's webinar. If you have any questions or if you require medical home support in your practice, please reach out to any of the contacts on the screen. We can certainly keep the line open for any immediate questions, so you're welcome to use the Q&A or chat function. And as Teresa mentioned, we appreciate you all being here and we appreciate you completing the post-evaluation survey so that we can continue adjusting these webinars to best fit your needs. And thank you so much.
Thank you, Kaylee and Julie. We do have one question in the Q&A, and it's, can transition resources be sent out via email? That would be yes. So in the post email, you'll find some links to some of the resources as well as some attachments. And if you want specific resources, you can always reach out to one of the contacts on the screen. I'll wait a couple of minutes to see if anybody else has any other questions. Check. I don't see anything in there. Once again, if you would like CE or CME credit or contact hours, please make sure to fill out the survey that's going to pop up at the end of this presentation. And with that being said, I don't see any other comments, so I think we are good for the session. Thank you so much, everybody who has attended, and I hope to see you next week for our next webinar session. Thank you so much. Bye-bye. Oh, I didn't see Patty was there.